Welcome to Ask a Mental Health Expert. Today, we're asking questions to Dr. Lief Fenno, psychiatrist at the Office-Based Opioid Treatment Clinic at Integral Care. What is a substance use disorder?
Substance use disorder, also known as addiction, is a medical disease that affects the brain's ability to encode reward, decide motivation, and make decisions. Clinically, we think of substance use disorders as the continued use of substances despite bad things happening to someone, despite adverse consequences. They're medical conditions that we think of as being similar to other chronic medical conditions like diabetes or high blood pressure, and that there are periods of stability and periods of time where patients need more intensive treatment. They're also very treatable with behavioral interventions, medications, and peer support. It's not a moral failing or an indication that someone is weak or lacking willpower, but again, is simply another medical condition.
What is the difference between substance use and misuse?
So substance use is taking medications as prescribed or using substances in a socially acceptable or generally accepted manner, whereas misuse is going beyond that. So examples would include overusing prescribed substances, using other people's prescription medications, or taking substances that are known to have a high degree of medical consequences associated with them that are very dangerous or that are known to cause you personally bad outcomes.
What do the research and science on prevention tell us?
We have decades of data showing that early intervention, education, and treatment can help to either prevent or decrease the harms associated with substance use disorders. This includes things like community programs, education of the potential bad consequences of substance use to youth, decreasing stigma in the community around either using substances or having people ask for treatment, and lowering the barriers to accessing treatment and information about substances. And taken together, we know that this can reduce the incidence of substance use disorder and terrible outcomes that affect everyone in the community, like overdose or communicable diseases.
What are some ways members of a community can help prevent substance use or misuse?
This is a great question. Everyone in a community has a role to play in preventing and mitigating the harms from substance use disorder. And this includes mothers, fathers, brothers, sisters, coaches, teachers, doctors, bosses, everybody. What you can do is model healthy coping strategies, encourage people to get help if you see that they're struggling, answer questions honestly and openly if young people or students or team members come to you with questions about substance use or concerns, and making sure that everyone has access to evidence-based treatments for substance use disorders, including critical interventions like naloxone or Narcan, which can and do save lives, even here in Austin and Travis County. And if you have concerns about yourself or a family member or friend using substances, to encourage them to get help by talking to their primary care doctor, their psychiatrist, or school nurse.
Thanks, Dr. Fenno. Remember, Integral Care is available for you anytime, day or night. Call our 24/7 helpline at 512-472-4357.